This is Nova Southeastern University's personal video essay for their occupational therapy program. My name is Philip Edgar Karstens. My Nova ID is N01678955. Question 1. Many students look for careers in which they can help others and make a difference in their lives. A number of fields offer opportunities to fulfill that need, such as nursing, psychology, physical therapy, and teaching. Please explain what distinguishes occupational therapy from other helping professions that you know about. I think occupational therapy distinguishes itself for two factors. One is their holistic approach to therapy relative to other therapies, and two is their one-on-one interactions with their patients relative to other medical professions. The first factor, their holistic approach to therapy, occupational therapists assess and treat mental and physical dysfunction with occupations. The physical aspect would be the fine motor coordination, and the mental aspect would be the communication between the brain and the muscles, or sensory processing in the brain that would in turn affect motor coordination. Now, starting with physical therapy and speech therapy, physical therapy focuses on gross motor movement and mobility. Speech therapy focuses on speaking, eating, and swallowing, problems with the throat muscles. I don't think either of them focus on the mental aspect of therapy as much as occupational therapy does. And going down the list of the other helping professions, teachers really only help children, in the primary schools, unless you're going into the university setting, in which case you would have adults and older adult students. With nursing, nurses rarely get to spend time with their patients just because they have so many patients they need to monitor. What nurses do is make sure the patients are comfortable, they receive their medication, and take vital signs of the patients. And, all of those tasks don't take that much time, and it's really that time that they interact with their patients. It's really not enough time for quality conversation and really getting to know them. With psychology, it involves little human anatomy. And although you are helping people with their problems, and it's required to talk about your personal life with a counselor, you're developing a professional bond through personal conversation. It's not like occupational therapy or the other therapies where you're just talking, you're just having a conversation. Physicians, in my opinion, are spending less and less time with their patients. I think it's because they're getting more involved in research. But the only doctors I can think of that would really know their patient and their personal life, are the primary care doctors and or the family physicians. But once those doctors refer you to specialized care, those physicians really, I think, only care about if you're experiencing any abnormal symptoms and making sure they put you on the right program for recovery. And even when you go see those specialized doctors, the appointments, sometimes you'd only see the physician's assistant and not even the physician. So in conclusion, occupational therapy focuses on aspects of the body and mind and allows the practitioners to really get to know their patients. Question 2. What are the factors that led you to believe that Nova Southeastern University was the right place for your occupational therapy education? The factor that appealed to me the most was the direct access to doctoral education. I'd be able to go straight into a doctorate program after receiving my master's if I had a GPA high enough. One of my long-term goals I wrote in my OT-CAS essay is to obtain a doctorate in OT, a clinical doctorate. And being able to transition straight from a master's to a doctorate would save me a lot of time and give me more opportunities earlier in my career. Your facility is beautiful. It's in a quiet part of Fort Lauderdale. I've toured it myself. It's state-of-the-art. I saw that Nova invested a lot into making this program a very good program. And they're also talking about the extensive resources that the students had access to. And it's just a comforting feeling to see a school so dedicated for their students to succeed. Another thing I liked about the campus was its convenience. It's close to several attractions and necessities, like the grocery store, the post office. And there are attractions, especially the beach, that could help release some of the stress of graduate school. You could unwind there. But more importantly, I have family that live very close to that school. And if I lived with them, I wouldn't have to worry about housing or getting a full-time job to pay bills. I could contribute more time to my studies. On the website, Nova talked about its diverse student population, and it was saying that students from all around the world go to Nova to get their occupational therapy degree, and I really like that, learning about others from different walks of life. I've had friends in undergraduate and in high school from different ethnicities and races. And that diverse exposure has actually taught me to be more empathetic and compassionate. And I think continuing to be immersed in that diversity is a good tool to prepare us, the students, for the diverse population that will seek therapy. The extracurricular opportunities, for example, the mission trips, that would give me exposure to older adults from different cultures, and it could probably teach me a thing or two I could bring back to the States when I do my career over there. When I was looking through the faculty, I came across two professors that had similar research interests as I do, that deal with gerontology. Dr. Kathy Pierce, who is interested in aging in place, and Dr. Raquel Dorn, who was interested in geriatrics. Now, if I'm accepted, I would love to work with them on their research and learn more about the elderly population. Question 3. Please describe a situation where you received feedback about your performance in school, work, or other activities that you disagreed with at first, but later recognized and accepted. How did you come to accept what you were told? For this question, I'm going to use my sociology class. Our professor in that class let us rate our own participation. We would do this evaluation before every test, and almost every evaluation I would say either 9 or 10 out of 10. It was 10 out of 10 at some eventually, because I did notice I was more engaged in class and more attentive. But my professor would always give me a 9 out of 10. And even on his own feedback, he would say, you need to push that a little more to get that 10 out of 10. And so by the end of the semester, I still didn't get that 10 out of 10. And I thought about it, and I believed that he did that so it kept pushing me to be more attentive in class, which it worked. And despite not getting the 10 out of 10, I still got the A in the class, so I didn't resent my professor for it, and I was able to reflect better on his reasoning for not giving me that perfect score. Question 4. You are assigned to work on a departmental project with another coworker that will market occupational therapy to physicians. This coworker has been at this facility longer than you and does not really see the need for the project. He has already told you that he is not willing to spend any extra time on the project. What would you do? Please explain your rationale. The first thing I would do is confront my coworker about why he doesn't see the need for the project. I'm a collaborative person and I value his input as well as his experience. So when we do get started on this project, I'll always try to include him on the decisions for it. I'll try to get his input on my ideas and hopefully incorporate some of his own ideas so he feels invested in this project and that his ideas are being portrayed accurately. And as far as not spending any extra time on it, and I'm assuming this extra time means off the clock, I wouldn't badger him about it. I would just make sure I get my coworker's input while we're still working. Thank you so much for this opportunity and further consideration to be in your program. I look forward to hearing from you.